I just start by welcoming and thanking you for coming today. Really appreciate your time to engage. And I'm very conscious that in talking this morning, I'll be talking to a mixed audience. Some of you will be steeped in public health reform and know quite a lot about it, while others maybe it's something that's going on in the background. But my guess for all of you, it is really important. It is about change, and I know that change is both exciting, but it's also unsettling, and you will want to get on to the questions about what this means and timescales, etc., in the panel discussion. But if you'll bear with me, because what I want to do this morning is give you a bit of background to why we're doing this, why is this change happening, and also the other bit that's really important is about you thinking about your contribution as part of this change. This change is really ambitious, not just for us in this room, but for the whole of the population of Scotland. But the key to it will be the contribution of all of us working together. So I guess my talk this morning is really about thinking the background and thinking through that. But we'll move on. I'll move on as quickly as we can to the issues that you will also be anxious to talk about this morning. The first slide here is really about what public health is, a science and an art of promoting, protecting well-being, preventing ill health and prolonging life through the organised efforts of society. I love that definition. I love the coming together of science and art, and I love the coming together of the whole of society to address the challenges that we're facing. So for me, it's a perfect summary. It's a summary of success that you are all very familiar with, and if we measure that in terms of life expectancy, a huge increase in life expectancy that can be directly contributed to public health, or at least a very significant proportion to it. And that is sometimes described in the public health world in waves. But I think we need to start by celebrating public health as an area of considerable success. But why public health reform, and what does it need to address? This slide here is a story of the challenges that we're facing, particularly in Scotland, and really since the first one here shows from the increase. Scotland's the red line, but the increasing gap between Scotland and other Western European countries in terms of how we're falling behind in terms of the health of the nation, our poor health relative to other Western European countries. This one over here, again, you will be familiar with it. It's the differences in terms of life expectancy between people who are living in the most affluent areas of Scotland and the areas where people are experiencing the most disadvantage and deprivation. It tells a story of differences. It tells a story of inequality. It tells a story of people's lack of access to opportunities and the ability to control their own lives and to control those factors that impact on their health. Many of you will be aware of this challenge around you, in the communities that surround you, but also across wider society. And that inequality is key to the increasing gap and why Scotland is lagging behind the rest of Western Europe. And that is a key challenge that we need to address. This challenge is experienced every day. This is the bit we read about every morning in the Herald, or every other paper we read in, which is really about we feel this in terms of the pressure on services. But that's just the manifestation of the deeper underlying issues. There's been a raft of reviews, etc., that have led to, I guess, the Health and Social Care Delivery Plan and the three key actions that we in the Public Health Reform team must address. The first one of that is to establish national priorities for public health in Scotland. And that is about those things that we as a nation need to focus on together that will address this challenge. It's about alignment, it's about working together and knowing what will make a difference. The next one, which is the one that you will be particularly concerned and interested in, is about the creation of a new national public health body. And the third one is about how do we get the whole system to work together? How do we address those underlying issues that are impacting on life expectancy in Scotland? And how do we do it together so that we're using all the levers of control in harmony for the greatest impact? This is our vision. We want Scotland to be a world leader. Just because we're behind the pack doesn't mean to say that there isn't a real opportunity for us to move ahead and move quickly, to make up the ground and to learn from other nations where circumstances are different. But most importantly, it's about using the assets that we've got, the assets that exist within the organisations that you're part of, how we use knowledge, data, intelligence, and it is about innovation. How do we do things differently? The things we've been doing up to now are good, but they haven't made the difference we need to make. And above all, it's about a culture for health. We all value our own health, but do we support a nation to take control of its health and make it easy for people to do that, create the circumstances for people? We talk about an environment drives, enables and sustains, but it's where individuals are enabled to take ownership of their health. That's our ultimate goal. Okay, I'm going to talk a wee bit now about that first action, which is the public health priorities, and describe where we've got to on that. This diagram here, I think you've all got a copy of the handout, so I won't go through it in detail, but basically what we've done in terms of a process is, I think for me what was key is we used those different ingredients, and we've learned a lot from that. We used expertise to help us develop evaluation criteria for what would make a good priority, what can really pull us together. We used a lot of engagement. We focused a lot on what people across the country are working on already. We went through all the local outcome improvement plans of councils just to see what is it that matters to people and what they're doing. We did the analysis. We came back to the expert advisory group again and finally produced the draft priorities that have been that were published in June. So, what the priorities are, it's a consensus, and our engagement process has given us that. So when I go out and talk about the priorities now, I'm meeting audiences who are broadly in agreement with them, because they're the things that they recognise that can and will make a difference. So it's a consensus, but it's what we'll work on over the next decade. There is no short, quick fixes on some of these issues. They're complex. So it's really about bracing ourselves for that long journey that we will work through in phases to improve the health. But they're not a statement of everything that we need to do. For instance, good quality health care will continue to be important and to be at the heart of the delivery of good health, of the nation's health, as also will health protection services. Good, robust health protection services are and will continue to remain important in our delivery. Okay, these are the public health priorities. I'm not sure if you've had a chance to look at them already, but I'll run through them quickly. The first one, and I think this one is personally is really, really important, particularly when we look at those kind of differentials from community to community and life expectancy. And the first one is primarily about place. The places that people live in, the physical environment, and the way that supports social inclusion and social cohesion so that people live with a sense of belonging within their community. Next one is about sustainable, inclusive economy and equality of outcomes for all. It's about people having good work, having access to income, whether from employment or from social security. But it's people having the means to sustain their own lives, but also sustain those social roles, whether it's as parents, granny, son, daughter, that are absolutely vital to the cohesion of society and communities as a whole. Flourish in early years. We know about the importance of those early years in terms of the preventative approach and creating the conditions for well-being in the future. Good mental well-being. A huge focus in our societies today, as our mental well-being is challenged by the level of insecurity and uncertainty that we experience in our own lives and across our communities. So a very strong focus there around how do we create the circumstances that enables all of us to deal with the stresses of life, but particularly for those people who are having to deal with the stress of poverty, etc. Next one is about reducing the harm from alcohol, tobacco and other drugs. And last but not least, eat well, healthy weight and are physically active. And again, that's probably on all of our personal agendas as well. But those are the priorities that we, through the engagement process, have agreed. And the principles, and I think this is key, they're all things we're working on at the moment. So how do we work differently across the system? How do we work differently to make that big jump and to achieve our ambitions? So it's about strong engagement and co-production, because that unity of intent is critical. It's only through engagement and conversations that we can make sure that as individuals and as organisations we get that alignment and we're all contributing to the solutions. Local ownership and responsiveness to local circumstances, often described moving away from that shift in statutory bodies of doing to communities and shifting more to participation and people engaging in the solutions and being the architects of the things that they want to see in their communities. Recognition that something different is needed. This is now a time when we pause and we think about what we can do that's different. So it is about innovation. It's about collaboration. It's about being intelligence-led and evidence-driven. And in terms of success, what we now need to do is to map out the different stages. Where will we be? And that's what we're engaged in at the moment. Where will we be at the end of year one, this time next year in the priorities, 3 years and 10 years. But as I said earlier, it's keeping our vision on that long-term journey and having the stickability. Everything we do won't work, but we will learn from everything that we do, and we'll build on the things that we will do that are producing results. Okay, that's the priorities. Published building consensus, leadership and commitment, collaboration, engaging communities, and we've set up a whole system reference group with representation from across the whole system to drive it. Public Health Scotland. I think this is really important in terms of what the organisation need to do, and it's about leadership. It's about the new organisation that will be called Public Health Scotland, providing leadership across the whole nation. Leadership for the public, leadership for all of the statutory agencies, and that leadership is based on the evidence and expertise within the organisation. But we need a strong voice in Scotland for Scotland's health, and it's about the new organisation moving into that space. It's about high quality, effective, supportive health improvement, health protection and public health functions. It's about building on the strength. These functions exist already and they are areas of considerable strength, but it's about building on those assets and looking at what we can do within this new landscape that we're creating. It's about being intelligence, data and evidence-led. And it's taking that expertise that exists within the organisations that you're part of and maximising its impact out there in the wider system. using that expertise to shape and form the policies and actions of others. That's where we really want to get to. Supporting delivery at a local level. It's about moving into communities and being able to really engage and use and support that. Strong leadership in relation to innovation, and it will bring together expertise, Health Scotland, Health Protection and ISD. So we're setting out the design in the best possible way. So we're designing the body to be able to do that. We're doing a series of commissions to inform the detailed design. And I think what's really important about these commissions is they've been co-produced. They've been led by folk with specialist knowledge from within Health Scotland, ISD, etc., but also with people from the wider system. So through the commissions, we're not just coming up with the design, but we're starting to reshape the culture through those conversations that are happening in the commissions. But most importantly, there's a strong focus in the commissions for creating this body that will work across the whole system and support the whole system. So this is the governance. This whole programme is owned by Scottish Government and COSLA, and that's critical because that partnership runs right through it, and that partnership will create the circumstances that will allow Public Health Scotland to support the whole and the wider system. The commissions, I'm not going to go through them in detail. There are a number of them that deal with the key functions: improving health, protecting health, improving services. Then the support functions, which is underpinning data and intelligence. Leadership for, there are also new functions there. So leadership for public health research, innovation and applied science. Leadership for the wider public health workforce. So we're starting to create a new language. I've spent a lot of time across local government telling them that they have a contribution to make to public health, and you don't need to have a public health title, in your title, but to be more conscious and to be consciously working towards improving the health of the nation and everything that they're doing, but also looking at how we optimise that specialist public health workforce, particularly in the interface between health boards and councils and the wider system. So, as I said, leads that cover, you'll see there a range of organisations contributing to the leadership and the shaping of these commissions. So it's a stepwise approach that they're undertaking. They're trying to understand the current situation, what's happening, but also moving on to looking at what Public Health Scotland's contribution will be in the future in each of the areas that the commissions are addressing. And again, coming up with a series of plans that will feed directly into the shaping of the new organisation. So where are we at? All the commissions are progressing. There is a specific OD commission in place to support the changes. Again, go back to my earlier statement about recognising the need for support and making sure that we're addressing the issues around culture and supporting staff around that. The Public Health Reform Team itself is working on the issues around the governance, which is the legislative requirements, the support service, etc. And the programme board is in place and reviewing progress and making sure. Key about is also, as we move ahead, is about linking all the commissions together and making sure that what we produce in the end is coherent. This is the timeline. We started 2014 with the review, moved on to review of public health. In 2016, really, that commitment within the delivery plan. 2017, engagement around identifying the public health priorities. Then in April of this year, a really significant step in the publication of the priorities. So that was the delivery of our first commitment, but also the name for this emerging new body, Public Health Scotland. Next spring we will have the commissions describing the functions of Public Health Scotland complete. We will have a chair appointed by Scottish Government and COSLA, and in the 1st of April we expect to have the legislation in place to create Public Health Scotland as a special health board to come into force. Then in the summer of next year, that's our milestone for having the Chief Executive appointed and the board appointed prior to the establishment of Public Health Scotland. And in autumn next year, we expect to have Public Health Scotland established to provide national leadership and a strong voice. Okay, that's our journey. But I think to go back to what I said at the beginning, that journey is about the challenge we face, and at the end of it, it is about being in a position to achieve that vision and our ambition for Scotland's public health.